Testicular torsion is a condition in which a patient's testicles rotate or spin. The disease is more common in young people. However, it can affect to male of all ages. The testicles are special glands found in man which produce sperm and testosterone hormone. Normally, the testicles are attached to the body by a sperm cord. The spermatic cord contains vas deferens and blood vessels. When a man is infected with testicular torsion, his sperm cord is twisted. Due to this torsion, the blood vessels close and blood supply to the testes stop. If this condition is not treated within 6 hours, the testicles may stop working and affect dangerously in human body. The main cause of testicular torsion is bell clapper deformity. Our testicles are usually firmly attached to the scrotum, making it difficult to twist. But with the bell clapper deformity, the testes are not attracted to the scrotum and that's why testicle easily twisted. Without this, testicular torsion can occur due to hard exercise or abnormal testicles. When testicles are twisted, the patients will feel a sharp pain in the testicles. That's why the testicles start to swell and begin to expand slightly. If a patient found these symptoms, they should be taken to a hospital immediately. This is very dangerous. Because of that, if you delay, then it can lead to the loss of testicles. For proper treatment, the doctor will use an ultrasound to observe the twisted testicles. Generally, the testes can rotate between 180 and 720 degrees. Afterward, the doctor opens the testicle twist and attach it to the joint to prevent it from coagulating. God bless you. Stay healthy, stay safe.